According to an analysis conducted by University College London scientists, serotonin levels and activity are not responsible for depression, implying that depression is not likely caused by a chemical imbalance. There is no other recognized pharmacological mechanism for how antidepressants work, and it is unlikely that they are the result of a chemical imbalance. Professor Joanna Moncrieff came to the conclusion that there is insufficient proof that anomalies in serotonin, such as low levels or decreased activity, contribute to depression. She said, the popularity of the chemical imbalance theory of depression has coincided with a huge increase in the use of antidepressants. Prescriptions for antidepressants have risen dramatically since the 1990s, with 1 in 6 adults in England and 2% of teenagers now being prescribed an antidepressant in a given year. Many people take antidepressants because they have been led to believe their depression has a biochemical cause, but this new research suggests this belief is not grounded in evidence. This comprehensive evaluation examined all relevant publications published in the most important areas of research on serotonin and depression. It discovered that research comparing levels of serotonin and its breakdown products in blood or brain fluids found no significant differences between patients with depression and healthy control comparison participants. Yet, investigations on serotonin receptors and the serotonin transporter found limited and contradictory evidence suggesting increased levels of serotonin activity in patients with depression. The researchers also looked into experiments in which serotonin levels were intentionally reduced in hundreds of participants by depriving them of an amino acid needed to make serotonin. A 2007 meta-analysis and a selection of recent investigations discovered that reducing serotonin in this method did not result in depression in hundreds of healthy volunteers. A small subgroup of adults with a family history of depression found very poor evidence, however, this only involved 75 participants, and more recent evidence was equivocal. According to research, there is no difference in gene variation between those with depression and healthy controls, and stressful life experiences increase people's chances of being depressed. A well-known early study discovered a link between stressful events, the kind of serotonin transporter gene a person possessed, and the risk of depression, but larger, more extensive investigations indicate this was a false conclusion. Furthermore, evidence from a large meta-analysis suggests that long-term antidepressant use lowers serotonin concentrations, implying that the increase in serotonin that some antidepressants produce in the short term may result in compensatory changes in the brain that have the opposite effect in the long term. These findings are significant since studies suggest that 85 to 90% of the general people believe that depression is caused by a lack of serotonin or a chemical imbalance. Psychotherapy, exercise, mindfulness, and treating underlying causes are a few examples of treatments that should be used to manage stressful or traumatic occurrences. Professor Moncrieff said, "Our view is that patients should not be told that depression is caused by low serotonin or by a chemical imbalance, and they should not be led to believe that antidepressants work by targeting these unproven abnormalities. We do not understand what antidepressants are doing to the brain exactly, and giving people this sort of misinformation prevents them from making an informed decision about whether to take antidepressants or not." Co-author Dr. Mark Horowitz said, "I had been taught that depression was caused by low serotonin in my psychiatry training and had even taught this to students in my own lectures. Being involved in this research was eye-opening and feels like everything I thought I knew has been flipped upside down." One interesting aspect in the studies we examined was how strong an effect adverse life events played in depression, suggesting low mood as a response to people's lives and cannot be boiled down to a simple chemical equation. Professor Moncrieff said, "Thousands of people suffer from side effects of antidepressants, including the severe withdrawal effects that can occur when people try to stop them, yet prescription rates continue to rise. We believe this situation has been driven partly by the false belief that depression is due to a chemical imbalance. It is high time to inform the public that this belief is not grounded in science." Given the possibility of harmful effects, the authors advise anybody thinking about discontinuing antidepressants to seek the opinion of a health practitioner. Professor Moncrieff and Dr. Horowitz are currently undertaking research into the best way to go off antidepressants gradually.